According to Bloomberg's vaccine tracker, 6.25 million doses of the vaccine have been given to Americans, and only 29% of shots distributed to states have been administered. We're 1 week into 2021 and well below the Trump administration's goal of administering 20 million doses by the end of last year. Dr. Anthony Fauci saying the U.S. needs a little more time to catch up on vaccinating the entire country. For more, let's bring in Dr. Dixon, CEO of UMass Memorial Health Care. Doctor, it's such a pleasure having you on the show. Thank you for your time. How has the vaccine rollout been at UMass so far, and how are you preparing to distribute the second round of these vaccine doses?
Great. Well, we're in week 4 now of our vaccine rollout. We were really slow to get started in terms of the amount of vaccine that arrived, and we really had the capacity to deliver about 5,000 vaccinations in week 1. We only received 1,950 doses, which we were able to stretch to 2,400 doses under the Pfizer protocol. So everybody's incredibly excited about it. It's just going slower than we want, not because we can't deliver the vaccine, because the vaccine just isn't arriving at the vaccination sites.
That is really good insight, Doctor. Thank you. And we know CNN just reported that President-elect Joe Biden will be releasing all available vaccine doses when he takes office, rather than holding back the second dose. How do you think this will help move along the vaccine rollout?
I think this will help a lot. What you can't get back is lost time, and there is some lost time in there that we had the capacity to deliver the vaccine, and we didn't have the vaccine to do. So, we're several weeks behind from where we really wanted to be, and you're not going to get those weeks back. You have to vaccinate, give 2 vaccinations, depending on the vaccine, either 3 or 4 weeks afterwards. And so you can't rush it in the sense that you have to wait that time. But we're excited that President Biden is going to release more of the vaccine. We're ready to go. Just finished working up in the emergency department. Everyone I worked with had at least their first dose, and which is really a change in terms of the mentality of what it's like to work in an emergency department after you've got the vaccine.
I have no doubt. We know the U.S. is lagging behind its goals to roll out vaccine doses. Doctor, why are we struggling so much with the rollout? Is it just how you mentioned earlier that we're not getting the vaccines quick enough?
We're not getting it quick enough for the places that have the capabilities to deliver a lot of vaccine. And then we are, kind of being methodical and I think in a good way about who gets vaccinated first. I think some of the vaccine envy that has been created by some states saying we're going to start with people other than hospital workers, COVID-facing workers first. The variation in the way it's been delivered, we saw in West Virginia, they were having long lines of patients and people that were able to get in, whereas at our institution, following the rules, we haven't vaccinated a single patient. So I think that's created a little bit of vaccine envy that hopefully, as we start to get more vaccine out, will go away.
Dr. Dixon, I want to elaborate on this because what you just said is so interesting because, yes, vaccinations are differing greatly from state to state. I want to talk about Bloomberg's tracking. They say South Dakota has used 55% of the doses sent to the state, while Georgia has only used 20%, like you mentioned. It does differ. So why are vaccine rollouts differing so much between the states? Does the federal government need to step in? Should this be handled by local and state governments?
Well, it's probably a case-by-case basis. I think here in Massachusetts, what you're hearing is we have the infrastructure across the major healthcare systems across the state. We're ready to go. Just give us a vaccine and we'll get it out. We'll get it distributed. And in other states, it doesn't seem like that's the case, and nor that the healthcare systems have played as significant a role. And it's hard because we're all doing extensive testing and, of course, taking care of a large number of patients. But I can only speak for here in Massachusetts. The frustration by my colleagues and myself is we need more vaccine because we want to get it out. We want to get patients taken care of. We'll start with first responders next week. And that's the holdup here. And we would be much further ahead if we had more vaccine.
You actually enrolled in the Pfizer clinical trial yourself, Dr. Dixon. What is your message for those who may be hesitant to take these vaccinations?
We had sought to enroll 300 patients here at UMass Medical School in the Pfizer trial, and we only got 200. There was concern. We didn't know it was safe and effective at that time, so myself and my wife both enrolled. We're both emergency physicians. And I ended up getting the vaccine in August, and my wife was in the placebo group, which created a little vaccine envy in my own household. But the second vaccine, you tend to have some muscle aches and a little bit of chills. It's gone in 12 to 24 hours. But boy, when I found out that I had got the vaccine, the confidence that you can go into work now, and we just put a COVID patient on a ventilator 30 minutes ago, and the confidence to say, geez, I've got this vaccine now, and I'm doing this life-saving procedure with my resident, it felt totally different than before I knew I had the vaccine.
You put a COVID patient on a ventilator 30 minutes ago. That's incredible. Thank you so much for sharing that. And I want to say I'm so glad you and your wife are doing okay after taking the first dose and the second dose of the vaccination. Doctor, before I let you go, I know this is a broad question, but what needs to be done to get doses of this vaccine out to more people quickly?
I think what we need is a transparent system at the federal level to say, this is how much vaccine is going out. This is how it's going to be distributed to the states. And then we that are ultimately going to be doing the vaccinations will know a week, even a few days before what's coming to the state, what's likely to hit here. We were just fortunate. I found out we got 975 doses of Pfizer is coming today for doing first responders on Monday. I wasn't sure we were going to have the vaccine to do them until this morning. And I don't think the state was sure they were getting the vaccine to distribute to us to do the first responders until this morning or yesterday. So that living day to day about what's coming and when it's coming, it doesn't have to happen. I know Pfizer knows how much vaccine they're going to give to the United States next week, but nobody else seems to know that, and then plan for that. We have 40 FTEs, 40 people dedicated to the vaccination program, and I could really use them in the testing program or taking care of COVID patients. But instead, I've got them in the vaccination program, and I don't know if I'm going to have work for them next week enough to give vaccine. And so it's a real waste of resources when we don't have resources to waste in healthcare right now. We're just all overwhelmed. We're trying to take care of COVID patients, testing and vaccine. So a transparent system at the federal government to say how much vaccine is coming, what states are going to get it, and then the states could do the same here. It's something I think Jeff Bezos could do in about a half hour with his team and Amazon in terms of distribution. It wouldn't seem to be that difficult.
You're probably right, and it does seem like a day-to-day situation. Dr. Dixon, thank you so much for your time and everything you and your colleagues do every single day. Dr. Eric Dixon, CEO of UMass Memorial Health Care.